Aloha, everyone. My name is Brian Talisian. I'm the Executive Director at Mental Health America of Hawaii. We're honored that you've made some space in your day for us. Today's webinar is titled Utilizing Lifestyle Medicine, presented by Doctors Cathy Moonshine and Benjamin Wing, which will explore how the 6 pillars of lifestyle medicine improve and sustain our physical and mental well-being. Dr. Cathy Moonshine is a clinical psychologist, certified substance abuse counselor, and lifestyle medicine professional practicing in Hilo. She provides teletherapy across the state. She enjoys bringing her therapy frenchies to sessions and spending time with them during her off time. Hopefully, they'll make an appearance here. Dr. Benjamin Wing is a second-year family medicine resident physician at the Hawaii Island Family Medicine Residency in Hilo, Hawaii. He has particular interest in patient and community education, lifestyle medicine, and the impact of social media on adolescent behavioral health. After residency, he plans to continue to serve the community of Hilo as a family physician. Outside of medicine, Dr. Wing enjoys table tennis, movies, video games, woodworking, bird watching, and most importantly, spending time with his family, and hopefully he's following our social media. Given that, I'd like to turn it over to our presenters. And just a reminder that this meeting is in webinar format, in meeting format, and don't feel pressure to have your camera on. As you probably noticed, we are recording this so that we can post it to our YouTube. Doctors Wing and Moonshine, I turn it over to you.
Great. All right, well, thanks for having us today. So we're very happy to be here. So Dr. Wing and I work together at the Hawaii Island Family Medicine Residency, which is embedded at the East Hawaii Primary Care Clinics and Hilo Medical Center. And part of what I, as a behavioral health specialist, and he as a primary care doctor, have worked with a number of patients and also with our colleagues and our own family and friends around wellness and being healthy from both our physical and our emotional health. And so we want to talk with you today about some of those strategies that might be helpful for you. Let's see, what else can I say about? So I've lived in Hilo for about 5 years. Previously, I lived on Maui and have done work on all of the islands. And then now with telehealth, being able to be more flexible with serving people. So that's a little bit about me. And then I'll see if I can round up my dogs and they'll say hi too. So Ben, is there anything you want to add about the work you do or who you are?
Yeah, I mean, nothing too much to add to the introduction already, but pretty much I grew up in Utah. I've moved around quite a bit. One of the big draws for coming here to the Big Island was this chance to learn a little bit more about not just family medicine, but also lifestyle medicine, which is something that is embedded into our program so we can receive dual certification in that. And it just really aligned with my interests and my practice style. And so that was kind of my initial draw, and fell in love with the population here and planning on continuing to stay here.
Great. All right. So we did put together a little PowerPoint. But feel free to ask us questions or, add information as needed. All right, so, and let me move move the Zoom window so I can see the slides myself. All right, so lifestyle medicine is an interprofessional group, an international group. And what lifestyle medicine is really trying to do is look at how do we live and how can we be healthy physically, emotionally, interpersonally. And one of the big focuses for lifestyle medicine is looking at the chronic diseases like hypertension, diabetes, obesity, heart issues, and how all of those are aggravated by how we live. They're better when we're living healthier and they're worse when we're not. And so things like having less physical activity in our life, not eating as healthy as we could, things like smoking and using substances problematically, all make the chronic health conditions worse. And so lifestyle medicine tries to help us work on all of that to be as healthy as we can be. Lifestyle medicine can be implemented or used in many places. The place Dr. Ben and I have, Dr. Wing and I have use them the most is in primary care, but even in the emergency room and even in my private practice where I'm seeing people solely for mental health, we can talk about how lifestyle medicine and the components of that can help us be healthier. And really it's this, we used to believe all of these different things that, people would go to their doctor for physical health and they'd go to their therapist for their mental health and they'd go to the substance abuse counselor for an addictions issue, right? But really we're all just one person. And so all of these strengths and weaknesses live inside ourselves. So lifestyle medicine is something that helps us look at how can we be healthy in all of those ways, physically, emotionally, cognitively, interpersonally, and maybe even spiritually. And so lifestyle medicine is an interprofessional team effort that may include physicians, behavioral health clinicians, other medical specialists, pharmacists, nutritionists, physical therapy, occupational therapy, health coaches, massage therapists, acupuncturists, right? Community members, pastors, all of those folks can be part of the lifestyle medicine team. And lifestyle medicine professionals work on health promotion and making lifestyle changes so that we are at our optimal physical and psychological health.
Just kind of to back off of that or piggyback off of that, one of the things that I found as a primary care provider over the last 2 years in my residency training is that we are oftentimes that kind of gateway that patients will come, they'll discuss their various different health difficulties, especially with some of those chronic diseases like heart disease, diabetes, high blood pressure, obesity, et cetera. And this is really the chance where we can give some specific guidance. What I really loved about lifestyle medicine is how it was a lot more than just saying you should eat better and you should exercise more. It really dives into some more of the evidence that research has shown is really helpful. So we'll kind of dive into some of those specifics as we move forward in this presentation. But that was one of the things that really was a draw for me as I was learning more about lifestyle medicine and as I continue to learn more about it in practice with recommendations for my patients. Exactly as Dr. Moonshine already kind of introduced, it's based off of 6 specific pillars, which again, we will dive into, but they're there at the bottom of the slide, just talking about a whole food, plant predominant eating pattern, physical activity, restorative sleep, stress management, avoiding risky substances, and positive social connections. We've got a really good graphic on the next slide here that just kind of outlines those 6 pillars. And I think again, we're going to dive into each of these and talk about some specifics as far as what lifestyle medicine recommends.
Right, yeah, and so this graphic image is really helpful to see that they're all sort of pieces of the pie. They all work well together. For some of us, we have strengths or we already do well in some of these areas, and then so we might be able to do better in other areas. And if something's not going well in one area, because there's times when life is stressful and that's out of our control, or, there's times when we're not able to get enough sleep. Dr. Wing is, in the middle of a residency program and is working many, many hours every week and sometimes having to work overnight. He also has young children at home. So there's times when, we all don't get the sleep we can get, but what else can we do during that time that's helpful, right? So using our support system when one thing isn't working well, using our support system is helpful. Remembering to drink water and eat healthy, even when we have a lot of stress. Making sure we get up and move. If we have limitations and can't move, eating healthy and managing stress and sleeping well. So there's ways that even when one is more problematic or out of our reach, that we can do some of the others to offset that.
And I think another big point that Dr. Moonshine just mentioned is, we all know that there's lots of competing demands when it comes to the life that we have to do between our careers, our families, et cetera. And there really is, I love this idea of finding balance in life. Do we truly ever find it? I feel like there's oftentimes we have so many balls that we're juggling, and at various different times, it's more so about, hey, what are our highest priorities right now? Maybe taking a time to set one of those balls down and allowing some of the other areas to kind of supplement in exactly what Dr. Moonshine was talking about. So this is, I think, a really good graphic where essentially, right, we're treating chronic disease. It's a lot more of a holistic approach, and it's a more conservative approach. And when you take a look at this little graphic here, it shows how lifestyle modification, oftentimes as a primary care provider, that is by recommendation, the first thing that I should be recommending for my patients. Anyone with high blood pressure, anyone with diabetes, that is the very first thing that I should be recommending, because like you can see here, it's very low risk. It's one of those things that's a lot more natural. It costs less. And that lifestyle modification does have an effect and an impact on our physiology. Moving forward from the physiology, we know that if we can kind of target those specific areas first, then we can try and limit things that are a little bit more expensive or things that are a little bit higher risk. So, for example, prescriptions, moving on to some of the more invasive procedures like surgeries, et cetera. Now, keeping in mind, the big thing that I would say is, from a primary care perspective, one of the big changes that we saw in the kind of the late 1980s was this transition over from a more authoritative or paternalistic type of method within medicine to more of a shared decision-making model. I think this fits in beautifully with lifestyle medicine because it's really about creating that partnership between patient and provider and really coming up with goals that you feel you can achieve. It's not about me saying, this is what you need to be doing. It's the process is there and I'm there to help guide. But at the end of the day, I like how one of my patients the other day mentioned 90% of the effort is me. And the other 10% is coming and just following up with you and making sure that everything is lining up well. And I think that really plays true with this lifestyle medicine approach, because at the end of the day, we can give these recommendations, but it's really about trying to help encourage you to continue on that path, and for all of us, really. And so, of course, from a primary care perspective, one of the best things that I can do is encourage that follow-up and just continuing to motivate and encourage and gauge that success and help kind of maintain that process of lifestyle modification.
Right. So then thinking about how therapists use the lifestyle medicine framework and helping people be physically and emotionally healthier. So, often traditional therapists might think about what's going on in early childhood relationships or what's happening with person's emotional health, but we're going to look at this from a broader perspective of what's going on with the client's biology, what are their psychological factors, what are their social factors, how are they doing in terms of housing, and do they have housing stress, do they have financial stress, is it, what is their economic situation and what they can afford, and how do you do some of these healthy strategies when you're living on the lower end of the socioeconomic. So we're going to think about all of that. We're going to think about oppression, racism, intergenerational trauma, and how that has an impact on health. And then we're going to use our psychological science to really move beyond just doing traditional therapy with folks to promote physical and emotional health, to prevent both physical and mental illnesses, and also to advocate to improve our medical systems, because those are kind of crazy making and traumatizing in their own way some of the time. We're going to look, and this is a big piece of what we do hand in hand with the other folks on the team, is the therapist is really skilled at looking at what's the motivation to make the changes and what's the barriers that get in the way of us being healthy and preventing illnesses, because that's, motivation for all of us is what's in it for me, why would I do this, this is really hard stuff, what do I care about. We're going to look at how people live and what choices they're making and help them realize that they can, in fact, make changes, and also look at the strengths of what they are doing and how they are maintaining in ways that it's not worse than it already is. We're going to help them look at what is helping them be healthy and how do they recover from or cope with any chronic conditions. And in this process, we do what's called health coaching, where we look at, okay, tell us how you're spending your time. How much time do you spend sitting down in front of the computer at the TV? How can we break that up and reduce sedentary time? Let's talk about how you're eating and what the economics are, and what is your knowledge about cooking? Do you even have access to a kitchen? And how do you eat healthier in a way that's enjoyable and fits in your life, right? And then this next bullet is really at the heart of what I do, encouraging people to breathe deeply, hydrate, with water and other healthy things, not alcohol so much, or even the energy drinks in excess can be problematic. Eating well, moving regularly, sleeping effectively, laughing, which is a huge stress reliever, making healthy connections, and then limiting substances. In addition, therapists can screen for the mental health conditions. We often do short-term psychotherapy that's focused on overall health, not just mental health or relationship issues. We provide a lot of education and clarification. And what often I've worked in, I've worked on primary care offices that we're there to support people understand what the primary care doctor is telling them, make sense of that and apply that in their life, right? And so that way we reinforce the messages of the healthcare team. So then thinking about how do people change and what motivates us, right? And for people who are, in professional roles, this slide might be helpful. But for those of you that are thinking about making changes in your own life or supporting other people about how they may be making choices and doing things different. So it's really helpful to start, and we can all do this individually on our own too. You don't necessarily need to have another person help with it. But the first step in thinking about making behavioral change in our life and maybe implementing some of the lifestyle medicine recommendations that we'll tell you about. The first is to assess where am I at? What's going on with me, right? Is that how am I healthy physically? How am I healthy emotionally? What are the things that aren't going well in my life? How might I be healthier? And then what's the overall context of my life that supports me in being healthy and maybe is a barrier to me being healthy? So what are my social cultural factors, right? How do I do that, given my economics, given the number of jobs I have, given the demands of school or family, right? What are the risks of doing it? How is it hard? How do I feel about it? What's my attitude about it? What are my family and friends think about, if someone decides they're going to start drinking less, and let's say they're a college student, that can be a challenge because the people around them may not really appreciate that and may not want that, right? And then what do you want to get out of the change? What are your preferences? What do you like? So one of the recommendations we're going to talk about is a whole food plant-based diet, being vegan. For many people, that's not their priority. That's okay. Right? Then how do we be healthier? What's the next level? And we'll talk about some alternatives, right? So just because there's one recommendation, there's always ways to adjust that and work with your preferences and with other people's preferences to make that happen. So first we want to assess where we are. And then if you're working with someone or yourself, you want to get ideas about how would I do that differently? What are the options to be healthier? What's my expected outcome? What do I want to get out of that? Given what I'm currently experiencing, what I'm concerned about with my health, what are my strengths, where do I have motivation, and what's going to work in my life, right? So then, if you have family or friends or a professional that you're talking to, then this is a place that they can help you think through all of these things. What are my options? What do I want to get out of it? And how does this help me, kind of thing. And then agreeing with yourself or agreeing with other persons, even if you're doing this mostly on your own, right? Telling people that you plan to change, your best friend, your spouse, your partner, your doctor, right? Telling people, okay, this is the course of action I've chosen. These are the goals I have for that. This is how I'm going to make it happen. Even if that's writing it down in a journal and telling yourself or putting that on a calendar. I recently set goals in my fitness app, and I look at those and I'm like, okay, that's really helpful that I agreed, I made a commitment to myself that that's what I'm going to work on, right? So first we assess, then we get the information and maybe some support and some advising from other people. We agree on what our goals are and maybe share that with folks. And then what kind of assistance do we need when we're making this change? Is it having a workout buddy? Is it having someone to cook dinner with that's also working on being healthy? Is it checking in with your doctors and sharing how we're doing? Is it getting a therapist or a health coach that's going to help you along the way? Is it using an app that helps you work through that? There's a lot of great apps out there. Some are free, some are low cost. And then what do you need to maintain it? So getting started with change for some people is really easy, but maintaining it weeks and months from now is hard. For other people, the getting started is really challenging, but once they get going, they're able to maintain it. But the arrange is about how do we arrange follow-up to make sure that we check in with ourselves like every week. Did we achieve our goals this week? Do we check in with our friends and say, hey, I'm doing great on my goals, or I stumbled a little bit, but I'm going to get back on track? Or is it seeing your primary care doctor every 3 months or your therapist every 2 weeks and saying, yep, I'm still working on that, or I've lost track of that, or now I want to add this thing, right? So this is a nice way to think about how we can all be successful in our behavior change, assessing where we're at and where we want to be, getting the information and education that we need, and maybe some advising, agreeing on a plan and some goals, getting the assistance that supports us in doing that, and then arranging for check-ins to see how we're doing with our progress. Okay, so that's a lot of sort of background or reasons why lifestyle medicine is important. This is the core of lifestyle medicine. These 6 pillars: diet, what we eat, exercise and movement, sleep, stress, connections, and limiting substances.
So now what we're going to do is we're going to dive into each of these, and I'll speak from a primary care perspective. And then, of course, Dr. Moonshine, if there's anything else you'd like to add for each of these pillars. But kind of the big things, right? So starting with diet, it's a lot more than just eat better. In general, lifestyle medicine does recommend a whole food, plant-based diet. So whole food is really talking about the way that you find the food out in nature is exactly how you would find it there on the table. So less of the processing, less of the canning process, all of those things, that adds up into, you can think about from a perspective of canned foods, for example. A lot of the time, there are going to be a lot of preservatives that go into that. A lot of time, there's going to be a lot of salt that goes into that, which is something that's going to affect, for example, high blood pressure. And so it's really trying to find things in their most natural state. Plant-based, obviously, is exactly as it sounds. There's nothing else there. I liked how Dr. Moonshine talked about, maybe this is not something that's for everyone. And so it's really trying to dive into what does your diet look like now? Where are some areas that we can make some improvements, whether it's added sugar, whether it's the amount of salt that you intake. So for example, a specific recommendation that I give my patients is no more than 2,300 milligrams of salt, added salt in a day. That equates to essentially 1 teaspoon, which is actually pretty difficult. But when you kind of dive into some of the specifics of how to read the labels on the nutrition facts, if the sodium number is bigger than the calorie number, then that's a really high salt food. That's one of those things that I think is a lot more manageable when talking to my patients who are just starting out in this. So there's lots of different degrees of suggestions that we can give to our patients. And I found quite a lot of success with specifically the salt one and blood pressure. And then most recently, there was a really exciting one that I'm going to talk about a little bit more. I may even allude to it a little bit more later down the line, but I had a patient with diabetes that was extremely not well controlled. And he was at the stage where truthfully, he should have been started on insulin, but he was very strong about saying, you know what? No, I don't want to do this. I want to go with lifestyle. I want to see what impact I can make on my diabetes just from lifestyle modification. And that's what he started with. He only started with diet. He hasn't even started to work in some of the physical activity, which is kind of the next step that I've been working on with him. But I just had his follow-up visit and he's lost 12% of his weight. So down from 360 down to 319, I think it was. He has completely reversed to his diabetes state to being completely well managed and at goal. I anticipate if he'll continue with this process, he'll be able to reverse his diabetes, which is just absolutely outstanding. And he did it strictly on diet alone.
Right. So diet is, of course, challenging because we like food and we do tend to eat. Some of us eat when we're bored, when we're stressed, we eat quickly, and we can eat large amounts. And unfortunately, calories add up quickly. And as we get older, our metabolism also slows down, and so we actually need less. So some things to think about here is, are we eating out of emotional reasons? Are we eating because we're tired? One recommendation is that if we just drink more water, we will actually eat less food because we will crave food when we're dehydrated. And another recommendation is to think about what we're eating. And the processed foods are easy and they're convenient. We didn't have these 50, 60 years ago, and we didn't have the obesity and chronic conditions that we have now. We didn't have the sedentary lifestyle as much then either. But to try to limit the things that we eat that come in cans and boxes. And so, maybe that's, you have one of those per meal, maybe you have one of those per day. And a way to sort of think about how you shop is, when going to the grocery store, is to buy most of your grocery items on the outside areas of the grocery store. So in the produce aisle, and if you're not a plant-based person, if you are, fabulous, great, but often people aren't, and particularly in this community, people love meat. I don't eat meat, but people love meat. Good for them. Eat fresh meat more than processed canned meat, but also some of the fresh meat like ham, sausage, bacon, that's all cured, and that is high salt content, right? But to think about when we buy things in the aisles of the grocery store, those tend to be highly processed. So just some ideas: portion control, maybe eating on smaller plates, drinking more water, dealing with our emotional needs so we're not turning to food. And any movement in this is good. From a chronic disease recommendation, if we reduce, most of us who may be overweight, reducing our weight by 5% will often dramatically decrease our chronic health condition. All right, so moving on to the second one.
Sorry, there was actually one other thing that I thought of while Dr. Moonshine was talking just about diet. One of the other things that I find is often helpful too is trying to limit eating out, mainly because it enables you to have better control of portion sizes. It enables you to have better control of what's actually going on the plate and in what amounts, and then obviously from like a salt perspective to control how much is going in there. Okay. Now, diving into the second bullet point of exercise.
We do have a hand raised.
Oh, yeah.
Let's see if we can figure that out. Let's see. Okay, Maui Farmer said, is there food vouchers for low-income patients to improve their nutrition? Yes, so a lot of there's often a local grocery store in most communities here in Hawaii. KTA does this. I think Foodland may also do it. I know the DPP program at Malama Ikeola was working. They had a farmer's market that you could use food vouchers for, but some of the grocery stores have a program where they do incentives where when you're buying fresh with your food vouchers and your food stamps, you actually get more than when you're buying the package. So there are definitely some programs, and a lot of our local communities are helping with that. And the reality is that eating fresh tends to be more expensive. Anything to add, Ben?
Nope, not at all.
Okay, go ahead with exercise then for this thing.
So exercise and movement in general, one of the main recommendations that we give is 150 minutes of moderate exercise per week. What this looks like generally for most people is going to be that 30 minutes 5 times a week. Moderate exercise, you can kind of think about it in terms of you may be able to talk while doing it, but kind of struggle to sing while doing it. So looking like you're brisk walking, some of your more low impact type exercises. You can half that amount or that recommendation amount if it's a little bit more of a vigorous exercise. So maybe one of those types of exercises that are a little bit more difficult to do while talking, for example. So you're looking at a little bit more of your higher impact things. So HIIT exercises or high intensity interval training, running, etc. This is generally the baseline of what we recommend, but the big thing is any movement is good movement, and the research has strongly shown that. And so if I am meeting a patient and they have not done any sort of physical activity or exercise in a very long time, I'm never going to say, this is where you need to be. One of the big things that lifestyle medicine talks about is there's those product goals of what you're aiming for. And then there's those process goals, or those steps that help you to achieve that. The biggest thing that I feel like I recommend when talking to my patients is I want to make sure that the goals that they set are things that they feel they can achieve. Some of you may have heard the concept of SMART goals, or specific, measurable, attainable, realistic, and time-bound. When you set those goals, you really want to have those moments where you say, okay, do I think I can walk 3 times a week for about 10 minutes? If they feel they can achieve that, that is what I stand by and encourage them to do, because it's really about those incremental steps, those process goals that help them to reach this ultimate goal of the 150 minutes per week.
Right. And then in terms of just not sitting still as much, it is being said in some of the PSAs and other places that sitting still for hours, days on end is just as bad as smoking. I don't know that that's entirely accurate, but sitting still as much as many of us do is not healthy. And so sitting less and standing a little bit more, right? And, some people have sit-stand desks these days, but one thing that we can do when we're sitting, and of course we have to work within any limitations. If people have a disability, if they have chronic pain, if they have knee issues, then you have to do the best you can with this. So this doesn't work for everyone, but as we're sitting in front of our computers, as we're playing video games, as we're watching TV, is to maybe stand up for 2 minutes every 20 minutes or 5 minutes every hour, just to break things up. And if you stand up, great. If you touch your toes, if you stretch, if you do a yoga pose, those are all good things. And one way to remember this is at the commercial breaks, or if you're a TV watcher, at the commercial breaks or between shows, that you're going to get up and move a little bit. Is that go outside and get some fresh air? Is it walk around the block? Is it throw the ball with your dog? Is it touch your toes? What can you do? But just getting up and standing up. And also give yourself credit for the ways that you do stand. Are you standing when you're doing the dishes? Are you standing when you're cooking? Are you, walking around? Do you have to walk to the bus stop a couple blocks? Great. Those all count. So any movement is good movement. Start where you're at, add things in there, work within any limitations. Also working within, in certain areas, it's not safe to be walking around. In terms of, it could be a trip hazard. It's not physically safe because there's bad people there, right? Weather is terrible, right? It rains a lot here in East Hawaii. It's not always a good time to go for a walk. So do the best you can. Any movement is good movement.
One great example that I've seen in the clinic is a patient who suffers from a lot of chronic back pains, lower back pains, which is very common. We see it all the time. And she had a really difficult time because of some of her other health complications, she had to sit for a long period of time because she had dialysis. And so she couldn't really get away from that. One of the things that we worked on was just trying to increase her movement a little bit more during the times on the days where she's not in dialysis. And she found that with just simply walking around and doing some simple lower back stretches, she was able to reduce some of her chronic pains, and she's much happier. She has better posture when sitting for her dialysis sessions. And that's been a really incredible thing to see. Moving on to this third bullet point of sleep. So obviously we try and encourage 7 hours or more. That's really what we should be aiming for. It allows that kind of regeneration, that rejuvenation that you need. Now, ultimately, this is going to look different for everyone. But the big thing that I generally will recommend when it comes to sleep is trying to optimize their sleep for what their situation is. One of the things that I found has been the most applicable is something called sleep hygiene. Many of you have probably heard of this, but it's a lot of things that we know about, but for some reason we don't always keep, myself included. There's lots that goes into sleep hygiene. And if you're at all interested in diving into it, just give it a Google search and you will get a plethora of information on it. But in a nutshell, it's about creating that sort of routine, that nighttime routine that you go to bed at the same time, you wake up at the same time. This is really important when it comes to regulating our sleep patterns and improving our restful sleep. Other common things that we do is try to avoid any electronics in bed. Really, in a sense, what you're trying to create is an association between your brain and the bed and sleep. Really, the only two things that I'll counsel that are acceptable activities in bed are sleep or sex, and that's it. Really, you want to create that association that as soon as your head hits the pillow, you're ready for sleep. And so that means removing any TVs, removing your phones, so that you're not doing those activities in bed. A common one that people will talk about is I read in bed. Reading is one of those things that for me personally, I fall asleep while doing it. I don't read in bed, but I remember watching my mom almost every night reading in bed. And again, sleep hygiene avoids or recommends against doing activities like that in bed, because what you're saying to your body is that it's okay to be awake while I'm laying in my bed. And so you're trying to kind of avoid some of those things. There's a whole lot more that goes into sleep hygiene, but that's kind of some common ones that I find.
Right. And so, yeah, reading is a great thing that helps us fall asleep. But sleep hygiene would say, get up, sit in a chair, even if it's in this bedroom. And then when you get sleepy, go back to bed. A couple things about sleep hygiene is that taking naps during the day, sometimes we have to do this, but we want to minimize that, because when we sleep during the day, it often gets in the way of the sleep drive at night. And then one of my one rule that I'm passionate about, but people have to do what they can do, is no phones during sleep hours. And I know this is controversial and I'm not perfect at it, but melatonin is a natural sleep hormone in our brain. And before we had modern society and had lights, melatonin worked really well, because when it is dark out, we have more melatonin. This is harder for people who try to sleep during the day because of work or other things going on in life. But we tend to have more melatonin in the evening, and then it starts to wane around sunrise. And as soon as we get light in the morning, the melatonin drops and we wake up. When we pick up our phones or look at our computers or play video games, it drops the melatonin significantly in our brain. It is hard to get back to sleep. And then with all of those examples, we're also interacting. We're scrolling, we're thinking, we're playing the game, we're interacting with the phone, and that is waking our brain up more. The TV, slightly better than the phone or the computer, because it tends to be across the room, and that's a little bit more of a passive activity. But any light will drop our melatonin levels. So if there's one thing that you're going to work on to help you sleep better, I would say put the phone down during sleep hours. And the other thing to know is that if you try to will yourself to sleep, you tell yourself you have to be asleep, that doesn't work. That actually will wake you up. And so if you do have some sleeplessness, or you're having insomnia, or you can't get to sleep, get out of bed, do low stress activities until you're sleepy. Trying to tell yourself, I've got to sleep right now, is almost a guarantee you will not be able to sleep right now.
From a stress management, the big thing is trying to increase these coping skills that we have. Now, coping skills are going to look different for everyone. There are mature and immature defense mechanisms that we use to cope with stress. So a common example that I like, because they juxtapose really well with each other, is that one defense mechanism we use to deal with stress is something called displacement. So this is where you had a really bad day at work, you come home, and maybe you just lose your patience with your kids or your spouse or someone who is considered a less threatening, what's the word that I'm looking for? Less threatening object or person. This is displacement. This would be considered an immature defense mechanism. On the flip side, the mature mechanism that falls kind of in line with similar type of approach is something called sublimation, where you take that stressful day and those stresses that you have in your life, and you channel it into something healthy. So whether that be exercise, or maybe it's something that's, you know, not actually displacing it onto another person, but onto a you know, the weights, or the, you know,
or being creative, or
Yep.
you know, laughing, watching a funny movie to, you know, change that energy, right? All of those things.
Yeah. So stress, there's a lot that goes into it. Some of the big things that Dr. Moonshine, you've got a lot of experience in this. Deep breathing is a huge thing. There's a lot of power in it, both on the physiological level, and it really, really helps. Mindfulness, meditation, yoga, all of these things are extremely helpful in dealing with stress. And then, of course, there's other different ways as well, making sure, and it's going to kind of tie into some of these other points as well, which is allowing you to talk with others or those that you're close with you in your friend or family group, to help kind of share the load of those stresses that you experience on a day-to-day basis.
Right. Yeah. And so for stress, definitely that's a time that going to see a therapist can be helpful. There's self-help books, there's community support meetings, there's apps, all of those things are good. At the, taking a deep breath down regulates our whole system. It changes how we're feeling physically. It changes how our brain is working. It shifts our emotions. That doesn't solve our problems, but it gets us grounded and gives us the bandwidth to then be able to deal with it. Connections, super important. Depending on where people are in the introversion, extroversion scale, depending on where they are with their trauma history, connections with other people aren't always fabulous, not always what they want, but having healthy connections with ourselves, when it fits, having healthy connections with our bio families and our Hanai families, feeling connected with friends physically and over technology, but also having, to not underestimate the importance of connections with our pets, with nature, and maybe the spirit, higher power, or God as you understand him or her. So having connections in ways that work for all of us is really healthy, both for us physically and emotionally.
And lastly, reducing substances. In general, lifestyle medicine really is going to focus on some of the more harmful substances. So for example, nicotine. There's also those effects of playing in, again, kind of to the diet with the sugar, with the caffeine, any other additional substances. One of the funny things that I thought of when we were preparing this this PowerPoint was, I remember at one point my dad was trying to make a lot of lifestyle changes. And he didn't smoke, he drank maybe occasionally, but he just didn't think, he wanted to take something out, but he didn't know what it was. And the more he thought about it, he was like, you know what? I eat a lot of chocolate. And truthfully, he did. He was putting chocolate chips on his waffles. He was eating it all throughout the day, every single meal and snacks, etc. And so he challenged himself to just say, you know what? I want to prove to myself that I can do this. I feel like I've got a problem, and I want to try and reduce it as much as I can. And he went 3 years without it, which was incredible. I didn't think I could ever see him do that. And so there's what this looks like is going to be different to everyone. But in general, lifestyle medicine, we're going to continue to encourage avoiding things like tobacco smoking because of a lot of the other additional risks that are associated with it, especially within regards to cancers, etc. So there's a lot that goes into these substances, but it's going to look different for everyone.
Right. And generally, certainly smoking, pretty unhealthy. Alcohol, unhealthy in some ways, but a little bit maybe okay. So for most things other than smoking, moderation is probably okay, depending on the individual. So not too much, not something in excess. So a resource that you guys have access to, this is in the public domain, is there's a Change That Matters website. It's through that University of Minnesota or Massachusetts? I think it's Minnesota. That if you go to this website that's right here, you can download all of these. And in the primary care setting and in my therapy practice, I use these. These are all little pamphlets that you can print out in black and white or in color. You can download them and just type into them. But there's little recommendations about how you can do each of them. And if we have time at the end, I'll pull some of them up to show you. But it's just a resource for you to have if you're looking for a little bit more. And the nice thing is that it gives you a structure. It's not too detailed. It's not a whole book. It's just 2 pages. And then you write down what you want to do. And there is some science behind when we make a commitment, when we develop a plan, when we write it down, we're much more likely to follow through with it.
Some of the benefits that we see from lifestyle medicine in regards to physical health, your quality of life, or any other type of benefits, you can probably think of quite a few of them. But again, keeping in mind that goals are going to be very personal and it's going to look different for everyone. You need to kind of individualize those. But really, when it comes down to some of the physical benefits, you're going to reduce serious risks from medical events and their complications. So things like stroke, heart attack. I've named a few there of some of the different things that you can see that are a result of some of these chronic diseases. you increase your longevity or your life expectancy, achieve a healthier weight, improve your energy and stamina, reduce things like abdominal discomfort, constipation, diarrhea, and reducing risks of cancer. I've kind of labeled those out there. Again, moving kind of onto the next page as well, there's additional benefits. And again, this is not a comprehensive list, but you reduce the need for some of your medical prescriptions, which can be both beneficial from a side effect standpoint, as well as a financial standpoint. You reduce the risk of needing to have frequent doctor's visits, hospitalizations, more invasive procedures such as surgery. There's that kind of image again. And there's also that impact, again, all of these pillars are very interconnected. And so it's important to recognize that when we have that improved mental health and that improved physical health, they definitely go hand in hand and they support and strengthen one another.
All right, so this is a graphic that I like to use, and actually you can pull it up on I just got it off the Google. I think it was posted on Facebook and I downloaded it. Is that the things that help us with our mental health? We call these the mental health all-stars, right? And if we start over here with just having routine, now for some people routine's not their thing, that's okay, but routine is good. A healthy amount of sleep. For some folks, having creative outlets, which can be a lot of different things, having social activity, healthy diet, having some amount of connection and love, which may be romantic love, but not necessarily. Doing some exercise. For some people, therapy is the thing for them. We're fortunate, that here we are in February in Hawaii, that we have sun and air. I know Maui got hit really hard with a lot of rain last weekend, and Oahu's pretty rainy, but in general, it's, not snowing and we can get out of our houses. Having a sense of humor and laughing really reduces our stress. And then having some mindfulness moments or meditation if it fits for you. You don't have to do all of these, but any or all of them are helpful. And then thinking about the lifestyle medicine interventions that we might use for mental health issues, I took the three big mental health diagnoses are the most common ones. And this is what I would recommend we do, and the priorities are different depending on where we're at. So folks that are struggling with anxiety, managing the stress is going to be the first thing I'm going to prioritize most of the time. And I'm going to do that through helping people breathe more deeply, having more gratitude in their lives, having some positive self-talk, and avoiding the avoiding. So avoiding is when, oh, I should do that, but I'm not going to do that. The more we avoid, the more it becomes a monkey on our back. So we try to lean in and face our fears. The next thing that I'm going to work on with someone who has anxiety is sleep, is improving their sleep and helping them see that they can't will themselves to sleep. Exercise to the extent that works for them. Exercise burns off a lot of nervous energy, so it is really helpful, but it's not for everyone and it doesn't fit. Avoiding caffeine, sugar, and other activating substances that make people more anxious. And drinking a lot of water, and then connections and little to no alcohol. So those are my best recommendations for anxiety. Moving on to someone with depression, and sometimes people have depression and anxiety. And so, again, and of course, we all get to decide, well, I don't want to work on stress, I want to work on connection. Great, if that's your priority, that's your priority. So for depression, exercise is going to be my first thing. And we know that cardio exercise is getting the heart rate up a little bit, has an antidepressant quality. Doing it outside and getting some fresh air and getting some sunlight also has an antidepressant quality. The next thing I work on with depression is stress management. With sleep, I want to help people not be sleeping too much or too little. Healthy diet, and avoiding comfort foods or reducing comfort foods. They're easy to do, but all those carbs really make us more sedentary and probably a little bit more depressed. And then, utilizing our relationships to feel better and get outside of ourselves. Alcohol is a physiological depressant and it disrupts healthy sleep. So alcohol in the midst of depression, not super helpful. And then for folks that have bipolar disorder, consistent sleep is my number one priority, helping them manage their stress and reduce impulsivity. Exercise is a great stress management technique for people with bipolar. Hydrating and eating well while avoiding excesses. Connecting with their family and friends to stay grounded. And people with bipolar, more than 50% of people with bipolar often have an addictions issue because they may be self-medicating. And so again, substances are not recommended for people with bipolar. So just a quick, nerdy sort of recommendation from a mental health perspective. And then the final slide that we want to share with you is a resource. So this is a federal grant program that University of Hawaii is administering. It's free telehealth services. Right now, the funding is for folks living in rural zip codes, so all the neighbor islands and the rural areas of Oahu, as well as houseless individuals, even living in urban Oahu. And then we're also hoping at some point to get another grant that will cover all of the urban zip codes. But it is free telehealth for kids and adults, and they have therapy and psychiatric prescriber. Right now, I don't know that we're doing there's any primary care services help happening, but that's a good community resource. Go to the website, check it out, share it with your family and friends. We have lots of capacity. Okay, now let me figure out how to stop sharing. Uh-oh, what do I do? All right, someone else can help me stop sharing. That would be fine too, because I can't get out of this. Oh, there it is. I see the stop sharing button now. Okay, there we are. So that is the bulk of the presentation that Ben and I had. Questions, comments, any pearls of wisdom you want to add?
Feel free to raise your hand or unmute and ask your question, or you can type it into the chat as well. Doesn't look like there's any.
Oh,
Hi.
Jessica's turned her camera on. She may have something.
Hi, I just wanted to say thank you for this. I personally in my life, I think I'm looking for this holistic approach, and I'm managing it to do it to some degree of a success. But I'm also a librarian, and I'm working with MHA, actually Dr. Goss, on creating these really cool social emotional learning kits for young children. So I'm really looking forward to using that last slide, if including that, as a handout and a resource for the families that will hopefully benefit from these kits, which focus primarily on mindfulness, using the garden as a metaphor, which has
Right.
possibilities. So I just wanted to thank you for the information.
You're welcome. Yes, yeah, and please spread the information about Hawaii telehealth far and wide. We have funding for at least the next 4 years, but hopefully it will continue on beyond that. So yeah, we're happy to serve more people in the community.
Thank you, Jessica. Go ahead, Dr. Moonshine.
Let me also show you, since we have a minute, this is the Change That Matters website. And you can go there and you can see all their publications, but you can then open this. They have them in English and Spanish, but this is an example of what this looks like. Is that it comes up, so it's like a trifold brochure, but here you can write out what are the goals for the week. Here's some tips about how to be a little healthier with food. And then the back page has the food and where we think, what are the my plate about, how much protein do we need, how much vegetables, does some education on that. So that's also a great resource to help people. So if you go to that Change That Matters, that can be helpful. I feel like I had one other thought about another resource, but it'll come back to me. So any other questions, comments? Ben, anything else to add that we didn't get to?
No, I don't think so. Thank you for letting us present.
Oh, I did. There's one other thing I wanted to share. So Apple has a free app called Balance that is free for a year, and it's about mindfulness and being physically and emotionally healthy. So that if you are an app person, you might check that out. There are a lot of apps out there. Some are free, some aren't, but this is one that I'm sharing because it's a pretty good app. And the fact that it's free for a year is pretty generous. All right, I think we're done talking.
Awesome. Thank you, Dr. Moonshine and Dr. Wing. One of my coworkers, folks, is going to drop the post survey so that we can share with the doctors any input that you folks might have. on today's presentation, I'm also going to be putting the link to our YouTube channel, which is where we're going to host the replay of this presentation today. There's also some quick videos on things that were mentioned, like sleep hygiene. There's a half-an-hour video on that, and there's also some breathing exercises like diaphragmatic breathing and some coping skills that you can watch as well. Jerry is going to pop Jerry, I think you sent that just to me. So if you could take a minute, it should, oh, she can't message everyone, she said. Sorry, let me do it here. If you could take the survey, will only take 3 minutes or so for you to complete. And this is, sorry for the delay on this. We should have the replay up by next Wednesday, and we'll send Drs. Moonshine and Dr. Wing the results of the post survey. And we hope you all have a wonderful weekend. Thank you again, Dr. Moonshine and Dr. Wing. This is really, really great. And the information is super invaluable, and I appreciate having you here.
Thanks for having us, Brian.
All right.
Thank
Aloha,
you.
everyone.
Take
Take care. Bye-bye.